Okay, guys, this is chapter 39, emergency preparedness. And there's a lot of important stuff in this one. So let's get to it. So it's all of our jobs to make sure that we try to prevent accidents and try to promote safety. Okay. Every person in the facility is responsible. And you also have to make sure that you're safe. That's really important. Don't forget that. Keep your clients safe. Keep you safe also. That's very important. Um, so Safety in the healthcare facility, that's not just the clients, the employees, any students that are there, any visitors that are there. Prevention is always better than trying to fix it after it's broken, right? So the goal is to prevent accidents and be prepared for emergencies and disasters. And most facilities have a safety committee or quality and safety committee, and their goals are to make sure that the workers are safe, keep track of accidents or injuries that happen on the job, those kinds of things. Clients have the right to expect that they're going to be safe when they go into a hospital or a facility. So what are the safety measures that the hospitals and facilities have to have? General emergency preparedness, plans for specific emergencies, tornado, hurricane, nuclear meltdown, that type of thing. Plans to evacuate. Where are they going to bring all those people? Their resuscitation policies. And they also, the client has the right to be sure that they're going to get the right medications and the right treatments. Accidents are preventable, not all, but most of them. And it's your job as the nurse to take action if there's a hazardous situation and to do something about it. Okay. So, fall risk assessment. Major goal is to prevent falls. And falls are the most common cause of injury for older folks, especially those that are disabled, sedated, confused, right? They should be assessed regularly for fall risk. We talked about the Morse fall risk scale. It's got to be documented. And some facilities will have clients have a special wristband with a specific color that indicates that they are a fall risk. Some facilities use something called shooting stars, where they'll put a star on the outside of the patient's door or by their room number to indicate that they're a fall risk, right? Because that's got to be in HIPAA compliance. If patients are fall risks, it's going to display in your electronic medical record, and they should have a care plan to go along with that if they're a high fall risk. And anytime anybody falls, there's an incident report that has to be completed. Okay. Whatever interventions you're doing, whether it's a low bed with a floor mat, a bed alarm, chair alarm, whatever, has to be documented. There has to be medications. Medications need to be evaluated. Are they on medications that are exceptionally sedating? Can anything be eliminated or decreased? Side rails, but remember, 2 side rails if needed and if they're not confused. Because if you put side rails up on the bed of a confused patient, they're going to try to climb out and they're going to get hurt. Make sure they're getting toileted and make sure they have something on their feet so that they're not going to slip. Okay. Fall risk assessment continued. Night lights. Make sure that there are night lights in use, right? Every room should have some type of night light. If it's appropriate, a bed alarm or a wander guard can be used. Bed alarms and chair alarms are alarms that are little tiny things that sit inside the chair or the bed. And if the patient gets up, they will alarm. Wander guards are sometimes they'll put them on the wrist or in the clothing. And if the patient gets to a certain point geographically in the building or in the yard beyond where they should be, it'll set off an alarm. We don't use restraints to protect somebody from falling. Okay. That is absolutely not appropriate. Restraints are used only if a patient is a danger to themselves or others. That's it. And client reorientation, you see, I crossed that out too. If a client is confused, if they have dementia of some sort, whether it's Alzheimer's or Lewy bodies or any dementia, reorienting the patient or attempting to reorient them is only going to agitate them. So diversify activities, those kinds of things, they do work. But, trying to tell them, listen, it's Tuesday. Don't you know it's Tuesday? You're escalating a situation, not a smart move. Okay, not a smart move. Electrical safety. Remember, water conducts electricity, so don't have wet hands and try touching something electrical. For the love of God, when you're disconnecting something, do not pull the cord to pull it out of the wall. Okay. grab it by the plug and pull it out. If there's any frayed or worn cords, report them immediately. If you're using equipment, when you're done, turn it off and unplug it. And notify maintenance if there's anything that's not working right, an IV pump or an enteral feeding pump, and notify your supervisor when you identify hazards, right? Sometimes there are problems with air quality. So in other words, if there's a problem with the heating or the air conditioning, report it, and don't let anybody smoke in the bathroom, okay? Any adverse event has to be reported. Right. So preventable events, pressure wounds, medication errors, client falls, injuries from faulty medical equipment, blood transfusion reactions, surgical errors. The list goes on and on. Healthcare associated infections. Anything that's an adverse event has to be reported. An incident report should be done. And an incident report would be done if there's a fall with or without injury to a patient, a staff member, or a visitor. Remember that. A patient, a visitor, or a staff member, if they fall with or without an injury, you must complete an incident report. And remember, we talked about this before. Incident reports are internal documents. They don't go to anybody except the unit supervisor or the DON or the QA, quality assurance, risk manager, one of those people, right? And when you fill it out, make sure that you're describing what happened, what you did, who you notified, and was there an injury? And if there was, how bad was it? What care should be taken for a client with a fall risk? So should it be ensure the call signal is easily reachable? Set the bed in a high position? Avoid the use of night lights for good sleep? So if you said A was the right answer, you were right, okay? They should have their call bell within reach. The bed should always be in a low position with the brakes on. And there should always be night lights. Just in case they do get up, at least there's some light there for them to see. Okay. OSHA. If you don't know who OSHA is, Occupational Safety and Health Administration. It's a governmental body that takes care or oversees safety in the workplace. If you work in a facility or wherever you work, you have the right to know about any hazards associated with your job, any chemicals or dangerous things that you're going to be working with. Okay. And occupational hazards can include, for nurses, can include things that are flammable, things that are combustible, poisons, skin or eye irritants, carcinogens, which are cancer-causing agents, biological agents, anthrax, radiation, chemical agents, medicinal agents, and even patient aggression. Sadly, but that's something that's an occupational hazard for nurses. There's something called the MSDS, Material Safety Data Sheet. And it's required by OSHA that a facility has MSDSs for everything that they have in the building, cleaning supplies and solutions, dressing change, wound dressing supplies, those kinds of things, saline. They have to have an MSDS safety data sheet for everything that you could possibly touch. Why? Because what if you swallow it? What if it splashes in your eyes? Right? Any of a number of things could happen. So the MSDS, this is an example that I put in for an Aquacell wound dressing. It's made by Convatec. It tells specifically who makes it, what kind of hazard it is, what's it made of, what you need to do for first aid, firefighting, accidental release, like in case it pops open. How do you handle it? How do you store it? Personal protective equipment needed. Stability and reactivity. Toxicological info, ecological info. How do you dispose of it? How do you transport it? Right? It's got all of those pieces, really critical pieces of information. Some things like normal saline. If that splashes in your eyes, no big deal. It's harmless. But what if hydrogen peroxide or betadine, right? Or any number of things splashed in your face? You might be a little concerned. And then for some things, there are color coded in the MSDS, whether the item that we're talking about is a health signal. In other words, what kind of injury could it cause to your health? Is it flammable? And that's in red. And is it reactive? And that's in yellow. Reactivity, in other words, can they deteriorate? Can they combust? Right? Those things. Two things that you need to know. Well, one thing really you need to know. This little sign right here looks like a fan. Okay, right there. That is the sign, international sign for radioactive. You need to know that, okay? Because radioactivity, radiation, yeah, we use it to treat cancer, but it can cause cancer too. So make sure you know that's that sign right there. It looks like a little fan and it means radioactive material. Make sure you have the local poison control center phone number, either stored in your phone or somewhere posted. Okay, always read labels, try to avoid spills, clean them up immediately. Use your PPE the way you're supposed to. Never use anything that's not in its original container. If it's not labeled, throw it away. If it's expired, throw it away. Okay. And never put something in a different container. Pet peeve of mine is sometimes patients will take all different meds and put them in one pill bottle. Bad move. You're asking for something bad to happen, right? Things like gasoline, paint, turpentine shouldn't be in a hot area. They should be in a basement, a shed, or a garage. Don't mix substances. Example, cleaning supplies. I had someone that I knew years ago that mixed bleach with Mr. Clean. The vapors, and oh my God, it was awful. You can really hurt yourself. So don't do that. Hairspray. Don't use hairspray or anything aerosol around an open flame because what you then have is a flamethrower. Okay. Keep areas well ventilated. And if there is radiation, make sure that you are following the protocols very carefully because radiation is very damaging. Okay. Um, Biological materials are hazardous. So in other words, a blood spill, you know, um, always wear gloves when you're cleaning stuff up, other protective gear if you need it. If it's a major spill, then they're going to call in special facility personnel to come clean it up. Okay. Um, Weapons, narcotics, and contraband. What is a weapon? A weapon is anything that you can use to threaten or hurt another person. So a weapon could be a gun, it could be a knife, it could be an ice pick, it could be a scalpel, it could be a set of hemostats. I mean, so many things can be a weapon. Keys can be a weapon. You know, a baseball bat is a weapon. If you are threatened or if there's anything, if you just get a bad feeling about something, whatever you do, don't escalate it. I've seen nurses escalate situations that could possibly have been de-escalated. If somebody is irate, if somebody is mentally ill, if somebody's becoming aggressive, argumentative, and you're concerned, you want to speak in a calm, soft voice. You don't want to disagree or argue with them, and you want to try to keep the situation as calm as possible. Okay. But get help, get security. And it's the same thing if somebody's trying to sneak in, you know, alcohol, narcotics, or other drugs. Okay. And you're going to document all of this as an incident report. What happened and who did what? Most facilities now have metal detectors, sadly. And for hospitals, if you're bringing big packages in, they may want to search them just to be sure that it's nothing bad. Flowers, people love flowers when they're in the hospital, but live plants and cut flowers are not allowed in the burn unit or the bone marrow transplant unit or the transplant unit or the oncology unit. Why? Live bacteria, viruses, spores, mold, fungi, etc. Tools and sharp items. I mean, don't come in there with a chainsaw. And cigarettes, lighters, smokeless tobacco, that's chew, usually not allowed. Workplace violence is something that we have to talk about, sadly, and it's becoming a more increasingly frequent problem. Again, de-escalate, de-escalate. You can really save lives if you just speak calmly and move back slowly. But don't argue. Don't, whatever they say, just yes, you're absolutely right. Don't argue with them. Get help. Okay. Keep yourself safe. Is the following statement true or false? Every healthcare team member must know who to notify in the case of an emergency and really shouldn't attempt to handle a dangerous situation by themselves. It's true, right? Get help. Make sure your patients all have their call light, teach them how to use it. Most bathrooms and facilities have a cord that's an emergency call that signals another alarm. So if they're in the bathroom and something happens, they can yank that cord if they've fallen or something and someone will come. Most facilities have a crash cart, but not all do. Hospitals have crash carts. Some skilled nursing facilities have crash carts, some don't. Hospitals are going to be a code blue. If you come across a patient or anyone for that matter that has no pulse and or no respirations, you would call code blue. Okay. And that is saying that there's someone who is pulseless and breathless and or breathless. Start CPR immediately. Know where your AED is. Some facilities have an automated external defibrillator. That's what an AED is. Hospitals do not. Hospitals have a crash cart with a defibrillator and a regular EKG, two separate things. An AED is all in one unit and it does all the heavy lifting for you. So you would just put these two pads on the patient. The machine will read their rhythm, the rhythm of their heart. And if necessary, it will shock the patient without you having to do anything. It will tell you clear. Okay. So know where that is and make sure you're current with your CPR and, BLS, basic life support. Personal preparedness. So make sure that you have a personal emergency preparedness plan for yourselves and your families. Okay. Because anything can happen. Have an exit plan for fires. Do you know how you would get out of the house if there was a fire? Is it more than one story? Right? These are things that you need to talk about. If there's smoke, you want to get down low. If you can, get a damp cloth, cover your mouth and nose because the smoke can burn your lungs and kill you. You want to get down as close to the floor as possible. If an article of clothing on you catches fire, stop, drop, and roll. Okay? Stay low. The smoke rises. Stay low, stop, drop, and roll to put the fire out. And do you have fire extinguishers? You should. Okay? You should. And everyone should have an emergency kit in case there's some kind of a disaster and you have to be evacuated. And this is directly from FEMA's website that says what the recommended things are, like your prescription meds, glasses, formula for the baby, diapers, pet food, water, supplies, cash, a little stash of cash. You should have a first aid kit, a flashlight, some kind of battery charger for your cell phone, because if there's no power, and some kind of a signal that you can use for help, like a flare or something, a whistle. So just look over the emergency kits and what you should have in there. This is something that you do need to know. Now there's something called a mass casualty event. It's a disaster, but it's where there's more injured than there are medical resources. So think of a volcano eruption, a major car accident involving multiple vehicles, or a bus accident involving two buses where you've got 75 injured people all at once. So disaster plan, it's activated when an incident produces so many casualties that the regular methods for client care can't be used. Okay. All facilities have a disaster plan, a disaster drill, a fire drill, bomb threat drill, active shooter drill, all those things. Okay. Internal versus external disasters. Internal disasters is where something happens inside the facility, radiation leak, biological spill, an explosion or something. External could be something, like I said, like a hurricane, a tornado, a tsunami, an earthquake, those kinds of things. And that's when the disaster plan would get activated. Okay. For staff notification, when there's an emergency going on, like in Florida, when there's a hurricane, there are alternative methods of communication. So if there's no telephone service, ham radios. What's a ham radio, you ask? Back in the day, it's their amateur radios that use a different radio wave frequency, not the same as cell phones. And usually when everything else is down, they work. Okay. Sometimes TV or radio broadcasts, portable, like walkie-talkies. And of course, the police would be available to help you also in a facility situation where there's a disaster. There's usually a meeting area outside of the building. So if there is a fire, then, that if, your unit needs to meet in parking lot A, right? And you should always have a roster of what patients are on that unit. And do you have them all? A census, right? I'm going to add that in there. Should have census. Patient census. So this way if you got everybody out. And then the triage system, this is important. Mass casualty triage is different than triage in an ER. Very different. This is the way we sort and classify people that are injured to determine who needs help first. And it's called the START system. That's the most widely used one. So there are tags, and this is what a tag looks like. Okay. It says START on it. It's simple triage and rapid treatment. So if the patient can walk on command and they don't have major injuries, they're green. If there's no respirations after a head tilt, that's a black tag. They may not be dead. They're probably imminent. They're going to die. We can't, it's going to sound terrible, but we don't waste our resources on someone that we probably can't save. Okay. Red tag means that they need to be treated right away and we can save them. Like, respirations over 30, perfusion, and you go by RPMs, respirations, perfusion, and mental status. And then anybody else would be yellow. They can wait. They have a scratch on their arm, something minor. And here are the colors broken down. So red is immediate, life-threatening, but we can save you. They get treated first. Yellow, serious, nah. Oh, wait, this is wrong. Oh, no, this is correct. Yellow, serious, but not life-threatening. And green, they're good. They can walk around. Black, they're probably not going to make it. They're imminent or expectant. In other words, if they're not already deceased, they're probably going to be deceased. In a hospital, in an emergency room, triage doesn't work this way. The sickest, most emergent people go back first. But that's because you're in an ER and you have resources. With a mass casualty problem, you have limited resources and tons of injured. So there has to be a way to save the ones that we can save. And the ones that we can't save, I mean, we can't save. Somebody, if you assess someone and they have pinpoint pupils that are non-reactive, head injury, closed or open, they're probably not going to make it. So that's the black tag. Evacuation. If you have to evacuate a facility, we get the people who can walk and self-propel wheelchairs. They get out first. We're going to transport the other patients. This is pretty funny that nurses, you don't need to know this, but I thought it was an interesting thing. If they work on a pediatric unit or NICU or nursery, they wear an apron, right? That looks like this, where they can carry multiple babies at once. This right here is a trauma board. This right here is a transport wheelchair, very lightweight. And here is a two-man fireman's lift, they call it. Normally, we don't deadlift people. However, if it's an emergency and we've got to get somebody out, with two people, we can lift the person out and get them to safety. Usually FEMA will get involved and they'll always send someone to search every area after evacuation to make sure that you got everybody, right? And reconcile the census. True or false, a nurse may be required to assist the triage. Absolutely. In Florida, you have to agree to do that when you get your Florida license. If there's a bomb threat, stay calm. You pick up the phone. We're going to blow up the second floor. Try to get them to talk. Try to keep them on the phone. You're going to blow up the second floor? I don't really like this place either. Why are you going to do that? What happened? Try to get them to stay on the line so they can be traced. Okay, very important. If there's an infant or baby abduction, which, believe it or not, used to happen back in the day. Now, most labor and delivery and nurseries the units are locked down. So you can't get in and out without a code, right? But still, anything could happen. Babies that are in bassinets in the nursery or the NICU should never be hand carried back and forth down hallways, like to see their mom or whatever. They should always be transported in their rolling bassinet. If you see a baby that looks like one of the babies that belongs in the hospital being carried away, that is a code pink usually, and they'll lock down the whole hospital. Okay. These days, when you deliver a baby in the hospital, the baby will have an ankle and wrist bracelet, both of them that are electronic, that matches with the barcode that matches a bracelet that's on mom. Okay. And every time that baby moves, they have to scan the barcode to make sure it's your baby. Of course, you're going to notify security and the police immediately and give them all the information that you possibly can. Strikes. You don't need to know this, but I will talk about this. Sometimes nurses are unionized and sometimes they go on strike because they're trying to negotiate for better pay or better work environment or better staffing ratios or whatever. They cannot force you to cross the picket line. Okay. It says here, if you're not on strike, you'll be expected to work. They cannot force you to cross the picket line. They can ask you to do it, but they can't make you do it. So if the nurses where you work, you're a nurse there and you guys are on strike, you can picket outside with a sign. If you don't want to, you don't have to, but you don't have to go to work either. Okay, just so you know. Not a test question, but just FYI. Fire. For a fire to be a fire, it needs a source of heat, a source of fuel, and it needs oxygen. Okay, so make sure you know where the fire alarms are and where the fire extinguishers are. Excuse me. Well, never prop open a fire door. Make sure hallways stay clear and there's nothing stored in the hallway obstructing if you need to get out or on the floor or on a windowsill. And there should always be fire drills on a regular basis. And know the different types of extinguishers. And we talked about that in the other PowerPoint, A, B, and C. And stay calm. Okay. Stay calm. If you panic, then the clients will panic. You got to try your best to stay calm. Okay. Code red is usually the code for a fire. Any fire has to be reported, even if you already put it out. You still have to report it. We talked about race and we talked about pass. Okay. And here's the definition of mass casualty. It's a mass casualty or intra-facility event that at least temporarily overwhelms or interrupts the normal flow of services of a hospital. Okay. And here they list all the different, not all of them, but many of the different types of things that can happen. That's why triage for a mass casualty event is very different with those color-coded tags than it would be in a normal hospital situation. Okay. If there's a tornado, which I don't think we get many tornadoes around here, but never, ever, and even with a fire, never use the elevator, right? Close the doors, close the windows, close the curtains, close the shades, because glass could shatter. Bed should always be in the lowest position. Get away from the windows. Any clients that are in bed, cover them with blankets, okay? You're better off in hallways away from windows or in bathrooms away from windows in the event of a tornado, okay? Radiation, this is bad, okay? The amount of exposure that you get exposed to is related to the time you're exposed, the distance you are from the source of the radiation, and any shielding that's being done. If there's a nuclear plant meltdown, Google Chernobyl or 5 Mile Island if you want to see what that looks like. If you are the facility where the patients are being treated that were, involved in a radiation explosion, radiation will cling to your clothing, your skin. Make sure that you are wearing water-resistant gowns, double gloves. Cover the patients as much as you can. Cover them up so that the radiation is not able to emit from them because they're radioactive. There's something called a dosimetry badge that measures the amount of radiation in the air. And you can use that to kind of, scan them to see how radioactive they are. Decontaminate them with water and soap and disposable towels. Okay. And only lead containers. Lead is the only thing that blocks radiation. And here I added some samples of what a patient looks like if, red tag, yellow tag, green tag, black. Hemorrhagic wound, a pneumothorax, collapsed lung, major burns, we can save you, but giddy up. Yellow, open fractures, minor burns. You can wait, but you're going to be next. Green, you're a walkie-talkie. You have something that's minuscule. Black, you're almost dead. And that's it for this one. That took longer than I thought it would. But at any rate, that was a lot of information, wasn't it? So I'm glad and I hope you enjoyed that. And until next time, see ya.